I am so honored to introduce our next speaker. I think you guys are in for a real treat. His name is Dr. NeilRiordan, and he is from the Stem Cell Institute in Panama. And we're going to be talking today about stem cells and autism. Thank you so much for being here, Dr. Riordan.
Oh, thank you, Kristen. I really appreciate the time.
Well, I am really excited because I feel like there's just a lot of questions out there when it comes to stem cell. And people, they might meet somebody, they might read something, and I think today is going to be just a great way to kind of answer a lot of those thoughts and those questions and concerns. What is the rationale behind your autism treatment protocols?
Well, the main rationale is that autism, the vast majority of people with autism have an inflammatory condition, and they have elevated inflammatory markers, and these molecules of inflammation can cause white matter swelling in the brain, and the cells that we use are mesenchymal cells. I'm just going to use the term MSC, mesenchymal stem cells, and the MSCs are our body's normal way of decreasing inflammation and basically maintaining the status quo in the body. And in autoimmune diseases, you'll find that the MSCs are in the body, which are found throughout your body. They surround every blood vessel in your body. You'll find that the MSCs are not functioning exactly as well as they could be. We see this in autoimmune diseases, and we see it in inflammatory conditions like autism. So the main rationale is that these cells, the MSCs, when they're infused, they shut down some of the inflammation that's going on in the body, and that's what we've found in autism, is that by giving them intravenously, they increase another kind of T cell that decreases the inflammation. So that's the main rationale for doing them. We wrote a paper, I think it was published about 10 years ago, on stem cell therapy for autism, and I believe it's been downloaded some 80,000 times, which is
Wow.
Which is a lot for a scientific article, and it's in the Journal of Translational Medicine. And in that, we describe both. We were talking about two kinds of stem cells, but the mesenchymal stem cell is very useful for inflammatory conditions, and that's the main reason we use it. And the cells we use are from the umbilical cord, so we call them day zero cells, and they're taken from live healthy births, and the mother is screened for infectious disease. And then we actually have a further screening process where because we have more than 3,000 patients, we were able to determine which the molecular signature of the cells that have the biggest anti-inflammatory effect. So we select from those umbilical cords. We might use 8. We might throw away 8 out of 10 or even more than that, depending on how they're running. But we're able to look at what the cells secrete and the capacity of the secretions of the cells to decrease inflammation. So that's the main misconception about the cells, is that they're actually becoming something in the body. And MSCs, when they're infused, they only live for 4 to 8 months. And during that period, they're secreting these molecules that are retraining the immune system to decrease the inflammation. So that's the main rationale, is using MSCs for the treatment of autism.
And so many kiddos we know, and other speakers that are part of the summit, the number one thing we talked about, a big portion was inflammation. So now I get questions asked all the time. Some people save their umbilical cord when they gave birth to their child or one of their children. Is it possible to use their own umbilical cords?
Well, it's possible, but it's very difficult, because most of those, in the U.S. anyway, those have to be released to a transplant facility only for the use of bone marrow restoration, and so the anti-inflammatory activity of umbilical cord blood stem cells, which includes the HSCs and the MSCs, is not near as high as what you can get from cultured umbilical cord MSCs, because we can get much higher numbers with the MSCs, and the MSCs are much more potent at decreasing inflammation than the HSCs. So, Duke University has done a study with using basically your stored umbilical cord blood, and they've had some beneficial results. The proof will be in the pudding when we finish these studies, but my sense is that the MSCs have a lot more potential to decrease inflammation and therefore would be more useful. There's also the logistics of getting the cells there and then expanding them. As you can imagine, if you're expanding one cord for one person, the investment to do that is much greater than if you're able to take one cord and, say, treat 40 people.
Got it.
So we have in the past we have done that. It's just very expensive, and also your cells may not be the best ones to decrease your inflammation. Whereas when we select for cells that have this potent anti-inflammatory effect, we can assure the anti-inflammatory benefit of those cells.
Now, you talked about how it helped, and the lifespan was about, I think you said, was it 5 to 8 months? What happens after those 8 months? Does the body, then immune system, kind of take on itself and at least help where those cells were, I guess, targeted?
Well, so just the fate of the cells themselves, we know because we're doing clinical studies even in the U.S. with for Duchenne's muscular dystrophy, and because they have we have biomarkers of how long the benefit is. For example, the oldest patient that we have an IND for in the U.S. is 31 years old, and he's been treated now for 8.5 years, and his lung function is very sensitive. We can do these lung function tests, and we do them every week on him, and we can tell where the benefit's trailing off, and that's usually between that 4 and 8 month period. And so we know that the cells are no longer helping him stimulate regeneration, because that's another thing the cells do, is they stimulate regeneration. So in his case, you got the anti-inflammatory activity, which is benefiting him, and then you have also the decrease in inflammation. And in his case, we see that these cells die off. And what happens is they're basically immune privileged when you first put them in, and then as they age, they start popping off molecules that say, "Hey, I'm not you," and they're gently cleared by the immune system. So that's the fate of the cells that are infused, which is really good from a safety perspective because they're not around forever. The benefits of them, in a genetic disease like Duchenne's, we see that the benefits trail off. For other conditions, particularly for purely immune and inflammatory conditions, we see that the benefit it can last much longer than just when the cells are alive. So when you're retraining the immune system, for example, in rheumatoid arthritis, we see that the benefit, we have studies now, large-scale studies of showing that the benefit persists a minimum of 8 months, and we have patients that are 8 years out that haven't had to be retreated. So once you reset the immune system, like with rheumatoid arthritis, it tends to stay. With multiple sclerosis, once we get over the hump, so I view MS as a problem. You have a rock going up a hill, but you don't know how big the rock is or how big the hill is. And so you need to get to that clinical benefit, and that tends to stay for a while as well. But it depends on the severity of the disease and how long they've had it. So does that answer your question?
Yeah, no, absolutely. Like, I find this just so fascinating. How do you administer stem cells? I know, and I asked the question, and just to let people know as well, I've actually been to the clinic in Panama with my son last September, so and we've seen definitely results, and we're very excited about it, and it's very hopeful. But for those that are listening, I know a lot of people are kind of confused, and how, do you take them like orally? Do you do it through an IV? Do you have to be put under? How do you guys administer them, and what's your recommendation?
Well, we administer them just intravenously, so we'll put a catheter, small catheter, into the arm, and then infuse them over a 10-minute period. And typically, people don't feel anything. I get questioned a lot about. We used to do intrathecal, or putting them into the spinal fluid. And what we found was that there was no added benefit of actually doing that, and also, there's a risk of a spinal headache. There's a risk of hitting a nerve. So once we did a cohort of just intravenous and compared them to intravenous and into the spinal fluid, we found that there was no difference in the outcomes. So rather than have that risk of going into the spinal fluid, we just removed that from the protocol. And when you think about it rationally, when you're trying to calm down the inflammation in the entire body, and you can put them into that spinal fluid, but the vast majority of the almost, if not all of the immune dysfunction is going on outside of the central nervous system. So that's why we put them IV. The same thing with MS. We originally had a protocol for MS, multiple sclerosis, treating them both IV and intrathecal, and we found there was absolutely no difference. We had the same amount of benefit when we gave them just IV, and then we decreased that risk factor from the intrathecal.
Now, for those that are listening, just paint a picture for you guys, and you can correct me if I'm wrong, and maybe things have changed because we were there last year. But, for somebody like with a child with autism, so my son is more, depending on the day, right, mild to moderate, because with autism it's a roller coaster ride, as many of us know. But, he's definitely delayed, and he's going to be 15 this week, and he's probably at about a first grade level. We were dealing with a lot of aggression prior to going, and that aggression went from, if I were to do on a scale of 1 to 10, that went from being an 11 when we showed up there, that had just come out of the blue, why we found you guys, to probably about a 1 to 2, and if that. It's so rare now. And then we've only done one treatment, and to us that was life-changing for us, and it was really, it showed us that, and that's the only thing we did different from all the other therapies we'd been doing. So we know for him he was a responder, and that's what we didn't know was going to happen. But for those that are sitting there listening, to paint a picture of what that looks like, and your child can go in, their clinic is, depending on where you go, I can only speak of where I've gone, which is Panama, but you go in and the clinic is just beyond, just so understanding. You don't have to stress out like your child's going to scream or be upset, like they've, I'm assuming, seen it all. My son had good days and not so good days, and they literally just put an IV in, and it's an IV push, and it was pretty much over within, I don't know, it felt like we were in and out of there in about 20 minutes. From start to finish, prepping and everything else. Would I be accurate in saying that's about standard how you guys do it, or is it different per person?
No, that's exactly about it. We have we have syringe pumps, and they're all set for 10 minutes. So the injection is going to take 10 minutes no matter what. And you need to get prepped and get the IV, and then we make sure we check the vital signs before we let you go. But there's a lot of free time when you're in Panama.
Well, and that was what's so nice about the hotel as well, because that was the other fear that I had was, oh my goodness, how is my son going to handle this? What happens if he had a meltdown? What happens if he gets upset? And I don't know who trained the people at the hotel, but they were the most compassionate, most understanding, most patient people that I've ever been around, which it made it very nice for my son's father and myself to not stress that if anything happened. We had special dietary requests. We needed a kitchen. We needed all this other stuff, and yet they handled everything for us, down to the fact that we needed a driver to hire to take us to the market so we could buy special foods and get other. We needed additional supplements while we were there, and it was just really made it easy and smooth, and we weren't stressed at all. I walked into the unknown. I had no clue what it was going to look like or be like, and I just took a leap of faith. And we're getting ready to hopefully go back before the end of this year, if not early next year, because we're that much of a believer in this. And so that's why I'm so excited to talk to you today and for other families to be able to hear about you. Now, this question comes up a lot, especially, in the autism community. It seems more so recently than before. But, why does the Stem Cell Institute use umbilical cord tissue stem cells instead of bone marrow stem cells or umbilical cord blood stem cells?
Okay. Well, as I alluded to earlier, the umbilical cord tissue cells, the MSCs that we derive from the cord tissue and then grow in the laboratory, are they're more potently anti-inflammatory than hematopoietic stem cells, or HSCs. And what you find in umbilical cord blood are a lot of HSCs, and what you find in bone marrow are a lot of HSCs and a few MSCs. So that's one benefit. The other benefit, of course, is our selection, our capacity to select for cells that have the most potent anti-inflammatory activity. So we actually have a surrogate test where we take and we culture the cells along with white blood cells that we purposely inflame, and then we can measure how much the addition of the MSCs, how much that inhibits that inflammatory process. And so we're able to select for cells that have really potent anti-inflammatory activity, whereas if you're using, for example, your own bone marrow, it's kind of a one-time deal. You can repeat it, but you won't have those cells in culture and be able to measure that anti-inflammatory activity. And if they don't have much, then even if you were to measure it, if that's your only tool in your toolbox, then you're still stuck with that, and that's what you have to use. In the case of cord blood, we have measured that, and there's orders of magnitude more anti-inflammatory activity using the cultured MSCs than there is just using the nucleated cells, which includes the stem cells, both types of stem cells from cord blood. So it's just if your target is inflammation, MSCs are a much better cell type, and also from the MSC standpoint, those from umbilical cord are better than from an adult or from your own bone marrow, and they're also, when you screen for them, they're even better yet. So that's why we use those cells.
Well, also as a mom, and maybe I'm wrong on this, and I'm clearly not a doctor. I am a mom, and when I hear about the bone marrow one, it does scare me because, my son has had to have a lot of dental work, and there's been moments we've had to put him under for dental work, and I don't like doing it, but it was such extensive dental work that we had to, he had to have surgery on his mouth, so it wasn't something he could be awake for. But there's always that risk, right? There's always a risk when anybody, not even just children with autism and, autoimmune issues, but there's always a risk even for if you and I were to go under. From what I'm understanding for the bone marrow ones, if you elect that particular method, they put the child under and, have to extract that from them, their own cells. My thought is, the recovery time on that, I'm thinking, okay, because I know they don't do that in the States. If they do, I don't know about it. So if somebody's listening and they write in and tell me, yes, they do, I apologize up front. I don't know about that. But I'm just thinking, I live in California, and California is a pretty kind of strict and a lot of crazy stuff right now, right? I'm born and raised here, so I can say that. They're getting a little cuckoo for Cocoa Puffs lately on some stuff, right? And what I'm nervous on as a mother is, okay, first of all, when I took my child to Panama, the looks I got were like, you're going to another country? What are you doing? I'm like, well, that's because they're not doing it here, and I don't know what you expect from me. This isn't going to hurt my kid, and I'm going to try it, kind of method is how I went about it. So then I hear about people or other places that you can go to another country and you can do this surgery and put your child under. And I'm thinking in my mind, okay, let's say that for whatever reason your child is a responder or non-responder, but the unnecessary risk of putting them under, because now you have to recover from that. And, I don't know, maybe there's side effects or not. Everybody's different. All of our bodies are unique. But now I come back to the States, and I'm thinking I'm in California, this is where I live, and my son or daughter ends up getting an infection due to the surgery. Because that happens. That happens even if you get surgeries here, right? So you then go to the emergency room, and I want to know, as a parent, you looking at that doctor saying, I just took my child with autism to another country to put them under to get them stem cell therapy from their bone marrow, and now they have an infection. I would be definitely afraid to say that to a traditional doctor in the ER in the States, and especially in California, because their thoughts and their opinions are definitely not outside the box. They're very much in the box most of the time, and that just worries me. I mean, is that something that am I just thinking too much, or what's your thoughts on that?
Well, I think it's. I don't know how they would react if you took your child in, but I would imagine there'd be some pushback and some funny looks. But I think that the main thing is if you're going to go somewhere, you want to know exactly what they're doing and how long they've been doing it, and those are and what kind of results are they getting and what's their safety profile. So I don't really know how to answer that question, but I know that our side effects are very, very low, and in our study we have a clinical trial that we completed, and we'll publish the results in the last 1 year follow-up comes off in July. So we'll publish that study of 33 patients. They were all severely autistic by CARS, Childhood Autism Rating Scale. And they were all from the tri-state area of New York. And the safety profile, I can tell you, there were the only side effects were pain at the site of infusion, and I think there were a few flu-like symptoms, but that was pretty much it. So the safety profile is very good. And on the results side, well, we have to wait until we publish that, but we're definitely seeing some good signals there. So I don't know if that answered your question. But
yeah, no, I'm just thinking, there's always side effects, potentially with anything you do. You can take a Tylenol and there could be a side effect, right? But I'm just thinking, the least amount of side effects, and if you're putting your child in a surgery kind of situation versus an IV push, I just think, to me, that's such a far less risk of an IV push versus putting a child under. But that's what.
Anytime you can avoid general anesthesia, it's pretty good.
Yeah, that was really my big thought on that, was just thinking, goodness, I just don't want families to not know all their options out there before they make their decision, because everybody's different. You all make your decisions, and if it works for you, great. I just want everybody to know all of the different options, out there. So, parents have reported, improvements. I've been on Yahoo groups and Facebook groups and everything else. What have you guys seen when it regards to ATech? Which, if you guys don't know what ATech means, that's the Autism Treatment Evaluation Checkoff list that you guys can all go and go online. And I'll post that. We'll make sure that site is part of this. So you guys can go check out how to do that. But has anybody reported their ATech scores going up?
I believe I don't believe that there are any that have gone up. There's some that didn't improve much, but
they've all gone down, hopefully.
Yeah. Well, the average, there's 70 out of all the ATECs we have, 75.3% have improved, and sort of the highest group of improvement are the ones that were the most severely affected. So I think like the 104 to 179, that was the improvement was 77% on the ATech score for that group.
Wow.
And I think at the low end we're about 30%, but I think the mean on it is about 60%, something like that, as far as the benefit. The 60% improvement of the ATech score, and that's in 75.3% of the patients, and that's using even the ones that didn't improve, but the entire, if you just look at the benefit, the percentage decrease in the score, it's about 60-some%.
Wow. And so for those of you guys who don't understand, the higher the score is, the more affected the child is. The lower the score is, the I guess, least affected they are, right, for lack of better terms. So basically, when you get the score, you'll kind of have an idea of where your child is in the range. And we always recommend people, anytime they're starting any new protocol, to take the ATech evaluation. You do it online. It takes about maybe 5 to 10 minutes. It's not a very hard thing to do. They actually email you your results pretty fast. And then what ends up happening is then in about 90 days or so, you would take the test again, and then that way you can determine where the numbers are going. And then, I don't know what your guys' protocol or standard is for that, but typically we always tell people to do it once a quarter, especially when you're doing a new therapy or treatment, so what way you can see if that treatment is, what that's doing and how that's helping. Often as parents, we're so into being in that world of autism that sometimes we don't actually see some of the gains, and then we do those tests and we go, oh, wow, like that, I forgot Johnny's doing this, and oh, I forgot, he's doing much better in this area or that area, and so that's what that is. And again, we'll make sure that website is listed so you guys can go ahead and take that. It doesn't cost you anything. It's free. It came out from, originally it used to be called Defeat Autism. Now it's Autism Research Institute, and it's a great tool to use. So now, when we're talking about IVs, we talked a little bit about this, but just to kind of go over it again, you guys don't have to sedate the children typically for the IV push, correct?
That's correct. The vast majority do not. There are a few cases where there's no way to do it, and we use a conscious sedation, but the vast majority we don't have to do sedation at all.
I can tell those that are listening that the first day we went in was a lot easier. I think by the third day, luckily, his father was there, and we did have to kind of hold him down a little bit, just like any time we got blood work or anything like that. We've all been through that if we've been in the biomedical world. But it felt like within about 30 seconds he understood it, and then he was fine. I'm assuming that's pretty typical for the patients you treat.
Yeah, I would say so, and even when one of the most amazing things I've ever seen is, and I've seen it more than once, is a child that was not at all thrilled about the treatment, and then they come for the second treatment and they just hold their arm out because they realized that it was beneficial to them. And I remember the first one, we had a Dr. Laura, and this patient called him Dr. Lala, and he walked in the front door. He says, "Where's Dr. Lala?" and held it on another treatment.
Oh, I'm sure that makes your heart get so happy. I mean, the work that you do is really life-changing. And questions we get often are, is this a one-time treatment, or do we have to do it more? And if we do have to do it more, how often? Is this something we do forever?
Well, that's a really good question that I don't have an answer for, but we're hoping this study, the 33 subject trial that we did, we did a series of 4 infusions every 3 months, and so we have the data and we can see how much overall improvement there was after 1 treatment, after 2 treatments, after 3 treatments, after 4 treatments, and you definitely see a very strong signal after 2 treatments. After the first treatment, we're measuring a lot of things. We're measuring the Childhood Autism Rating Scale. We have ATEX. We're doing quantitative EEG. We're looking at 31 markers of inflammation in the blood. The 2 that are most important, I believe, the 2 that track that closely track the severity of symptoms they're called MDC and TARC. And those two, what we saw was there was a significant improvement in both of those overall if you statistically analyze all the patients. And there was a sharp decrease after the second one as well. And then those tend to flatten out. And the ones that there's a really strong correlation between the patients who dropped the most dramatically, they had the biggest improvements clinically as well. So I can't answer the question because we don't know. I think we've had patients that have come down a total of maybe 7 times, and so each time they saw improvement, that led them to come the next time. So I could say I think on average, people will typically will come down a second time if they had a benefit the first time. And I'd love to know the answer to that question myself, but we don't know exactly, and we're also working on timing. What's the best timing? Is it every 3 months, or is it 4 months, 6 months, 12 months? So as you can imagine, there are a lot of data, and the challenge is to try and figure that out, and that's the reason we did the clinical trial, to get at least as much potent information as we can, because we have some 1,800 data points on each child, so we know we can see, at least have a really good idea of where the dosing schedule, if it's working, and all those things.
Now, is there, I know when I was there, they had said, if you do decide to come back, because I asked that question, like, how soon are we supposed to, is it 6 months, 9 months, a year? And they had said, you wait until you kind of see the child not improving dramatically, or not having more gains, like maybe they've kind of plateaued from their gains, which is, it's hard to kind of recognize also with a child's autism, right?
Right.
Because there's all the different things you're always doing. Would that still be the answer that you would, because you guys are still learning more about it, would that still be the answer you'd kind of go with?
Yeah, I think that's the most rational way, and that's what we've done with like I said, with the genetic diseases, with the Duchenne's. That's how we did that, was by looking at those biomarkers and determining when we were losing. So when we started, we were doing it every 6 months, and then we saw that there was some decline prior to the 6 months. So then we went back to FDA and we changed it to every 4 months, and now we don't see any decline after that, the 4 months. But that's entirely different. It's a purely genetic disease with entirely different mechanism of action for the cells. So, but it was based on how the patients were doing, and that seems to make the most sense.
If they, let's say, for example, is there a way, let me see how I can word this question. So is there a way that, let's say they've gone and, is there any time that you wait too long? So let's say they would have maybe potentially been better to do 9 months, but maybe the person didn't, see it the right way, and they came at like 12 or 13 months. Is there anything that's going to not be as beneficial if you wait too long? Or does it matter? Well,
I don't believe that's the case, because we typically don't see the gains being lost with autism, whereas with a downward spiraling genetic condition, you're going to definitely see the gains lost. But I guess that's why it's kind of hard to tell, as you mentioned, with autism, are we plateaued, or are we seeing any more benefits? But typically we don't see loss of the benefit when it gains so much, and then we've had people wait as long as a year and a half, 2 years, and they come back and then they get another bump, and wait another year and get another bump. So I don't think there's a big detriment of waiting. I think at some point, typically between 6 and 8 to 12 months, you're going to see no more improvement, and I wouldn't expect to lose what you've already gained, but I don't expect to get any more once that starts to plateau.
Got it. And then, is there a certain age that you you can't go, or is there a certain age that you have to be able to go?
We have, I think we've had from 3 to 25. I think is our span. At one, you were talking about aggression. We had a 25-year-old that was. Well, there's aggression is one thing. We had a teenager that was very large. He was over 240 pounds, and
wow.
And his mother, she actually became pregnant again, and she was concerned about he would attack her, and he had, he's pretty potent, he's a strong guy.
Yeah.
And so she was concerned about having a new baby in the house, and these nighttime attacks, and so she brought him down, and I think it was about 16 or 15. The aggression went away dramatically. And then we had the oldest patient that I'm aware of is 25, and he had older parents, and I think they were around 65. They were around 40 when he was born, and they were just wanting him to be able to, wondering what's going to happen after they're gone. So, and he improved quite a bit as well. He was able to move into a group home, and they were quite happy with that, so that he could, after they're gone, he could have a life, so to speak.
Oh, I love those stories, because often we hear, there's this kind of window, and if you don't hit that window of by the time they were 2 or by the time they were 4, or, whatever they decide, whatever window that is, I love that there's something for, those of us that have been around a while but maybe didn't know about this. Like my son was going to be 15, and we found out about it when he was 14, and we'd heard about stem cell, but we didn't really know anybody that had done it. It felt like it was kind of in the wind, but like nobody really knew anything. I feel like more and more I'm hearing more and more about it, and which is very, very, very exciting. Is there a one question we get often, is there a reason that it's in Panama and it's not in the States right now?
Yeah, it has to do with it costs $2.5 billion to get a drug approved. That's the number one barrier. And the reason we went to Panama is they passed a law in 2004 that it actually banned embryonic stem cell research and treatment, but at the same time it enabled doctors were able to treat patients with adult stem cells, including umbilical cord cells, and that's why we actually went there to begin with, to carry on our research. And since then, there are a couple of other laws and rules and regulations have been published that they're very reasonable and sane, and they're accepting of our safety data, and so there's actually a stem cell law that passed in 2013 in Panama that tightly regulates the use of cells in clinical studies. But we've been there, like I said, we've been open since 2007, and it was because of that 2004 law that we went there. And things are not, they're not easy, and it's not as expensive as, to get an approval there as it is in the U.S., but it's getting more and more difficult. But the main thing in the U.S. is that you have to do everything under IND. And so to give you an example for these cases of that we're doing with Duchenne's muscular dystrophy under IND in the U.S., the first one cost over $500,000 just to get the IND. And then the second one, it was a lot easier, and we have to produce them in laboratories that are very, very expensive to hire. We basically hire them to they take our cells from Panama and then they grow them in the U.S. and it costs about our cost to do it is over $30,000 just per treatment round for them. So the cost, because of the regulatory environment in the U.S., is just way higher than it is in Panama, and that's why we carry on in Panama. But we do intend to go forward in the U.S. First of all with Duchenne's, because we already have our protocols, our CMCs, our manufacturing methods are approved by the FDA for IND use in the U.S. So that's our first target, and then we're going to work our way up the list. But because we already have a foothold on Duchenne's, that's likely going to be our first large-scale study that we do in the U.S. But of course, it takes funding, and that's what we're looking at funding sources from foundations and that sort of thing to actually do the trials. And so that's why we're in Panama, as long and the short of it, and ultimately hope to be, in the U.S. and around the world, but we're just taking it one step at a time. But I think with this clinical trial, it's really catapulted us to a new level, and just having this really strict controlled clinical trial showing safety and hopefully benefit, which we'll publish later this year, that we can go to the next level and go internationally with it.
It'd be really nice to be able to be in the States and be able to have treatment of this caliber, for our children with autism. So it definitely sounds like it's in the future, maybe a little bit farther than what we want, but it definitely sounds like it's in the future, on the horizon at least. Some of the people that I've spoken to, swear that they know this person or that person in the States doing it, but every time I've tried to research it, it doesn't appear that what they're doing is, for lack of a better word, legal, or it's not just, I don't know. I can't find anywhere that it's showing that it's okay to do. And am I wrong on that? Are there different places here that are legal, and they're just trying to jump into it because they see benefit? I mean, that's, people always ask me, why do you go to Panama? Why don't you go somewhere down the street, kind of thing? And when I've seen, different things on websites, I look, but nothing seems to add up, and it doesn't feel like it should add up, I guess, if that makes any sense. Is there different laws, like, in different areas? I mean, am I wrong? Is it legal here and I'm unaware of it?
No, I think it's, we were the first to ever do fat-derived stem cells in human beings, and our first publication, I think, was about 10 years ago on that. And if I felt like it was perfectly fine and legal to do it in the U.S., I would be doing it. I don't have a comfort level. Some people maybe don't mind walking the line. There are warning letters that have gone out from the FDA to people doing that sort of thing in the U.S., and I don't have a comfort level of taking somebody's fat out, isolating the stem cells, and give them back in the same day, because I can't guarantee the sterility of those. The minimum standard for that is a 10-day culture to make sure. And if you were to store those cells for 10 days and to make sure that product is sterile before you give it to somebody, then that is definitely illegal. So I think a lot of the same-day procedures are relying on that it's just under medical practice, and they're doing it that way. So I think those are probably the places that are proliferating in the U.S., and I don't have a comfort level at all, number one, on the sterility, and number two, the cells tend to home where there's damaged tissue. So if I'm going to do a liposuction on somebody at 11 a.m. and then give them those cells back at 3 or 4 in the afternoon, a lot of them are going to go right back to the super inflamed area where you just injured them to take out the fat. So I don't quite understand the rationale, and there may be some benefit, but I don't like. I like to sleep at night, and number one. Number two, I don't want to. Well, the main thing is anybody, and I think there's a real possibility to have a contaminated product, because you cannot guarantee the sterility of it in a same-day procedure.
And I think that's important for those listening out there, because sometimes, I feel like people always say, oh, stem cells so expensive, and, these people can do it cheaper. And, you have to be very careful of where you go and just do your homework and really do your research. And, I can tell you this, with autism, I've yet to find anything that's not, it's not cheap, I can't find anything, regardless if it's therapy that you're doing with your child, whether it be foods or supplements that you're buying, unfortunately and fortunately. So unfortunately, we live in a time where, it seems like a lot of things cost a lot of money. Fortunately, we live in a time where science is advancing to where we have more options, and we have more things to choose from to consider, because I know I can only imagine, I don't really know, but I can only imagine the mom that got child diagnosed in the 1960s or 70s or even the 1980s, there really wasn't any options, and really these are options that we're now seeing, I would say probably the last 20 years when it comes to therapies and different diets, and really 10 years on some of them. So, really be careful on who you're taking your child to, number one, regardless of what treatment it is, and two, to do your homework on those people, because I have been approached many times by people saying, why didn't you just go here? Why didn't you go there? And I said, well, because Panama is the one who kind of started a lot of this with children with autism. I'm going to go to the source, and I'm hoping more and more people learn your guys' protocol, and I'm hoping more and more people work with you guys, because it would be nice for more families in other countries and, other people to expand on this, because, you've done all this work. And, so let's talk a little bit about that. Can you give a little bit of background of why you even got into this and why you're so passionate about this?
Well, I used to be a cancer researcher, and I got into that because of very personal reasons, because of my second mom had a horrible death from cancer of the tongue. She never smoked, never drank, never cursed or anything, and so I thought it was horribly unfair for her to go down the way she did, and I was not very happy with the way she was treated, and so my first foray into cell therapy was dendritic cell therapy, and we developed a dendritic. It's a therapeutic cancer vaccine, and there's actually one that's been approved for prostate cancer in the U.S., but we started this in the 90s. And out of that, one of the things that I noticed was we would give a drug called GCSF. It would stimulate the bone marrow to produce more stem cells, and they would spill out into the circulation, and then we would capture them. And one thing I noticed is that inflammatory conditions, when you use that drug, sometimes got better before we even made the vaccine, that patients would get better. And so, and about that same time, Osiris, which is the first company in the world that has an approved drug product using MSCs, was doing clinical trials and showing great clinical benefit. And so my first patent application in this world of stem cells was to take bone marrow stem cells and grow them, expand them, and also umbilical cord stem cells and grow them and expand them. Any kind of HSC, the first patent was on that, and that's how I got started. And then we took that same technology and transferred it to the MSC, and it was very, very early on that I could see that the HSC is great if you have a malignancy or if you have some disease that you need to wipe out your bone marrow. That was very valuable. But I could also see that wide array of inflammatory diseases, autoimmune diseases, and we do a fair amount of spinal cord injury, and I could see that these cells had these three qualities. They could decrease inflammation, they could correct an imbalanced immune system, and they could stimulate regeneration. So I saw the potential being much greater to help a lot more people, and that's why I got, with it's just sort of everything came together at once, and we had the technology to grow the cells. We had the Osiris doing the great pioneering work on using them for treating graft versus host disease, and then we had the location, so it all came together, and then we just started.
And wow, look at everything you've done now because of that. I mean, that's just blows my mind how things happen and you don't know where you're going to end up, right?
Yeah, exactly. It's been a wild ride, but it's certainly been fun. And I just completed a book about a month ago that should be out hopefully by the time this airs, and it's called STEM, which tells the story, STEM with a question mark. It tells the story of how I got into this and where we started and where we are now, and it talks about all the different conditions that we have clinical trials for in Panama. So we have autoimmune diseases and, of course, autism. We have orthopedics and respiratory things and heart failure and spinal cord injury, and the book is written for the lay public, and it's written at a level that hopefully everybody can understand. I try not to use many big words except for ones I can't get away with, can't get out of, like mesenchymal. And it's a bit memoirish for a few chapters, and then everything else is about the rationale. And each condition has interviews with patients. So
I always think of books like that called mommy terms, or you wrote it in mommy terms, so that way we understood. Because I don't like the supercalifragilisticexpialidocious words, right? Like those are too long. Right. But when you write it in mommy terms, we understand that more. And so will that be on Amazon? And how do we get that?
Yeah, it should be on Amazon by at least mid-May, and we have it. Everything's done. It's a whole process, but it's in layout right now. And we're finishing some illustrations, and then it'll go to print, and we have to do a few more, checks to make sure everything got uploaded correctly, and then we'll start printing. So it should be exciting. Should be by mid-May. We'll have them in hand and on Amazon.
Now, lastly, is there such a thing that I heard about called a stem cell clinical trial for autism? Is that happening right now?
Well, yes. So there's, Duke just finished. They used stem cells from the umbilical cord blood, and they just published their study. I think it came out yesterday or the day before. It's just recent, I think yesterday. And Duke is doing a lot of work in this, and I think their goal is to. I was actually I reviewed some of their for a foundation. I reviewed some of their applications, and their intent is to move into MSCs. I think it's going to be a few years, but that's their intent. And they use the umbilical cord blood because it's a lower regulatory barrier because it's autologous. The huge limiting factor, of course, is you had to have banked that, and then after one treatment you're done because there's no more. So that's the big limitation for the study. But they did have some benefit, and I think hopefully they'll get into some bigger trials using MSCs, and I believe it's their intent to do that.
Well, and parents can, if they're looking into that, they can probably I would imagine, just Google Duke and autism and some type of stem cell trial, correct?
Right, that's correct. And another good tool is clinicaltrials.gov, and you can go on there and type in autism and stem cells or autism mesenchymal, and it'll show you all the studies that are active and studies that have been completed and that sort of thing. And certainly Duke or anybody else who's doing a clinical trial should be on clinicaltrials.gov. Very
good. Well, I feel like, honestly, if you're listening, this is the first time you guys have heard about stem cell, or if you've heard about it and you had questions, I truly feel like this has been such an informative talk. And I mean, I continue to learn, and we've already had a treatment, and I continue to learn. And I'm so grateful for doctors such as yourself, really, putting that path in front of us so that we can at least have that option to go down that road. And I know that it's not for everybody, and I know that, everybody's different, everybody responds differently, and you may have gone to another place and that worked for you as well. So it's not about that. It's really just about trying to learn as much as you can and make sure the place you go to is reputable and understands what they're doing. And I feel like you guys have really kind of laid the groundwork for a lot of people out there. So thank you for everything that you've done.
Oh, well, thank you, Kristen. Appreciate it. Thank you so much for the time. And I think what you're doing is amazing as well, reaching out to so many people and giving opportunity to learn more in an environment that seems to work. You don't have to travel. You can actually, do it from your own home and learn more about different therapies and things you can do.
Absolutely, because as parents of children with autism, for us to be able to leave sometimes hard, and this way we can learn as much as we can, even if we're sitting in our pajamas. For those that want to learn more about Panama, please go to cellmedicine.com. Again, we will have that also listed, but that's Cell Medicine, that's CELL, medicine.com. Is there any other websites you'd like them to have?
I think that's it. There's a cell therapy foundation that's educational about stem cells, celltherapyfoundation.org, and that might be useful as well.
Perfect.
That's several people in the field are working on that to create education on adult stem cell use.
That's great. So you guys have lots of information now. You have lots of homework and different follow-ups with these websites. What final message do you want to leave parents that might be sitting there thinking, gosh, I'm feeling hopeless, I'm feeling scared, I'm feeling a little bit lost? What message do you want to leave for those parents?
Well, I think there's a lot to be learned, but I think there's certainly some hope here. We've seen in many people, and I think we're learning. I think we're on a logarithmic learning curve period, and I think it would be good to talk to other people if you're interested in doing something like this. Talk to other people who've been through it to see if it's right for you. And anyway, I hope our publication comes out in a timely fashion. You can read that and have your physician read it and see if it's something that might be useful for you.
Absolutely. And at the end of the day, just not to give up on hope that, it seems as though we're continuing to move forward in science, and sometimes it takes a little longer than we want it to take, but as long as we're going up, that's all that matters. So thank you so much again, and thank you for all that have listened.